So basically how I wanted to do this was I wanted to have you guys take this exam first, and I want you to have your answers with you. Now, this is 100% like a discussion on this exam. So there are certain questions on here that they were challenging, right? Some of them are not like, and there were even a couple that I read and was like, yeah, I think there's either a mistype here or something was wrong. And we'll discuss those when I find it. But yeah, man, hopefully you guys wrote down some questions that maybe you can ask, and we'll knock this thing out. So this should be I think this is an excellent way to prepare for the National Registry. You know, the more tests that you take, the better you get at them, especially if you have a chance of understanding what you did wrong. So let's jump into it. First one, which of the following conditions causes permanent damage to the aortic and mitral valves? So there's several things here that are interesting, right? And sometimes we want to do like process of elimination. So two of these things actually have to do with endocrine disorders, right? First one is Conn syndrome. Conn syndrome is a endocrine disorder that has to do with the adrenal glands. And Addison's crisis, who here remembers what Addison's crisis is, or Addison's disease? Does anyone remember that one? Also adrenal gland, right? Adrenal insufficiency.
It doesn't produce enough hormone.
What was that, Rubio? You like broke up.
Sorry, I was saying it doesn't produce enough hormone, right? Adrenal insufficiency.
Right, exactly right. Now this B, cardiac distress, I have no idea what that is. I tried like looking it up and seeing if there's anything on it. I think they made that up. I don't know. Now with rheumatic fever, interestingly enough, rheumatic fever can cause permanent damage to the heart, right? Including damaged heart valves, and will actually cause heart failure. Treatment can ease pain, reduce damage of inflammation, and even prevent rheumatic fever from occurring. So this type of infection or fever will cause heart damage. So that answer was D, rheumatic fever. Number two, which of the following statements is correct concerning cardiac biomarkers? Now, the term cardiac biomarkers doesn't get brought up a lot in paramedic. But what's interesting is when you look at anatomy, the anatomy chapter in the latest paramedic book, chapter 8, Nancy Caroline, they do talk about biomarkers. And the biomarkers, you got to understand there's 3 of them. Okay. One of them that is extremely popular that people talk about is troponin. Now, what these biomarkers are used for is when they draw labs at the hospital, they can look at these cardiac biomarkers and they can say definitively that this person is having a heart attack or an MI, right? So there's 3, like I said, troponin, myoglobin. Myoglobin is a protein in muscle. And the last one is creatine kinase. And I can even write it down if you guys need me to. I'll write it down in the chat. I highly recommend you make notes. So troponin and myoglobin. Okay. So those are the 3 different biomarkers. Now, when we say, well, what is the, almost lost my, when we say what's the answer is cardiac biomarkers tests can determine if an acute myocardial infarction, B, Bravo, is the answer for that one.
Definitely.
Yep. Number 3, 58-year-old is complaining of severe epigastric pain, nausea, vomiting, and he reports pain that radiates to their back. You know, peri-umbilical ecchymosis. Anybody remember what that's called? There's a name for it.
Isn't it Great Turners?
It's
colon sign. Colon sign.
Ray Turner's is the flanks. I'm sorry.
Yep, exactly right. But that's good that you remember that word, because those are the two that are popular when we talk about bleeding inside the peritoneal cavity, right? So we got
Right.
Frank Turner's and Cullen's. So
Collins.
go ahead.
Collins has a U. Umbilicus has a U. That's how I
All
remember.
right.
I just messed that up.
Hey man, that's a good
And
idea.
that's the background noise. ¿Qué pasó?
All right, so we got a low blood pressure, right? Right there, teetering on hypotensive, 90/56, heart rate of 120. So basically, what they're trying to do is paint that this patient's in shock. Temperature of 102. You know that's no good, and I'm going to talk about why. Skin is cool, moist, and pale. Again, they're painting shock. Based on the patient's presentation, what's your differential diagnosis?
B.
Now, what do you think?
I think B.
B
Yeah.
or D? Or is it C?
Damn.
So this is an interesting one, and I'm gonna let's work this one out. So first off, if we said, hey man, this is salmonella, now there's only one thing that's really like pointing at salmonella, right? And that's a fever. It's not talking about nausea, vomiting, even though it actually, I'm sorry, it is talking about nausea, vomiting. So that's another thing that there is with salmonella. But the fact that this guy's in shock and is cool, moist, pale, we got obvious bleeding in the abdomen. There's other things going on, right? We can rule out salmonella. Next,
The low blood pressure.
Yep, low blood pressure too is, again, we're talking about shock.
I have a question.
Yeah.
I know we're talking about bleeding in the abdominal cavity, and the pain he has it radiates to the back, but it's not in the back. So wouldn't that kind of rule out pancreatitis? Because that would be more like retroperitoneal pain,
right? And what does retroperitoneal mean?
In the back.
Right. So again, retroperitoneal, when we say, all that means is it's not in the back. It just means it's behind the peritoneal cavity. Now the peritoneal cavity is, that's where all your main organs, your intestines, all that stuff, it lives. This is just right behind it, right? So just because, like, if you look up pancreatitis and you look up the actual signs and symptoms, yeah, man, we're talking about nausea, vomiting, abdominal pain, right? These are all different things that we need to consider. Now, before we get into pancreatitis, even though pancreatitis is the answer here,
what is it?
Let's talk about aortic dissection and how we could rule out aortic dissection. Typically with an aortic dissection, our patient, for one's not going to have a fever, right? They're going to have test questions will always say tearing pain, acute tearing pain that basically came out of nowhere, right? And pending doom. That's usually how they like to word it. The patient's got like a pending doom, and they could be going into shock, but they would not have periumbilical or Cullen sign. That's one thing that they would not have with a aortic dissection. And another thing is, again, they would not have a fever. Small bowel obstruction, they could have the nausea, they could have the vomiting, they could have some of these things, but they would not be in shock with a small bowel obstruction. Okay, the best answer was pancreatitis. Remember, your pancreas, anything that kind of like spills into the abdomen, right? We know this is retroperitoneal, but that once it ruptures or it's infected and it causes pain, it can leak, right? Because it's a hollow organ. And when things start leaking into the abdominal space, that's when we can start seeing that those Cullen signs, things of that sort. So maybe this person, I wish they would have gave us a little bit more info on how long maybe this has been going on. But remember, pain that radiates to the back, that was giving away that it was pancreatitis. And then the fact that it's a temp with shock, that's the best answer. Number 4, if the appendix ruptures, purulent material can leak into the thin membrane that forms a sac containing the abdominal organs, right? This condition is called what?
Would it be peritonitis?
Absolutely. It will be peritonitis, right? So we say the peritoneal cavity remember, is your abdominal cavity. So that's where we got our appendix, our intestines, our liver, our spleen, all these different things are living inside that cavity. You get a rupture. Now, this term purulent, all that means it's like an infection, right? So it's like white pus, purulent sputum. It gets brought up when like people have respiratory infections, but purulent material that leaks into the membrane. That is 100% peritonitis. This patient's going to have rebound tenderness. So if you remember what that means, you push on their stomach, they won't have pain, but when you let go, ow, right? They're going to have pain there. And also they will have distension. And these patients will have a fever. They can become very septic and sick. Good. Number 5, which of the following characteristics are associated with digoxin? Select 3 answers or answer options that are correct. Dig.
A, C, and E.
Ooh, he was close. You said E, vasodilator. So dig is not a vaso.
No.
Oh, you said
A as in alpha, C as in Charlie, and E as in echo.
okay. So you said it decreases peripheral vascular resistance.
Correct.
So let's talk about why we would use dig, right? Dig is used for AFib.
Positive inotropic and negative chronotropic, right?
It's used to basically lower rate, typically. Okay, it's known to treat heart failure and AFib. So it tries to like relax the heart. Now, a lot of these patients that are on dig, believe it or not, if they like have a dig overdose, it's very odd that dig will actually speed up the heart rate. And some of these patients can have like AFib that goes haywire. Now, looking at the answers, believe it or not, the correct answers is A. He was right on A. Increases myocardial contractility. So it strengthens that heart. Remember, we said that this is for patients that have heart failure. So weak hearts, people that are on dig, their hearts need to be strengthened. Okay. The next one is C. Patients that have dig is indicated for congestive heart failure. We just said we can use it for heart failure. Sorry. And then the last one is F. Adverse effects will include dysrhythmias. So like I said, patients that can potentially take too much, they throw super fast heart rates. So typically, like me as a provider, if I ever am treating dig, I'm usually treating it because it's the person's either A, having an adverse reaction to their dig, or they've taken too much of it. The treatment for dig toxicity is we cardiovert at low dose. Okay. We cardiovert low dose cardioversion. And when I say that, it's very odd, but they will start, depending on your protocols, even as low as like 5 to 10 joules. And they work their way up on dig toxicity patients. Lucas says, so does dig increase or decrease heart rate? So what it's supposed to do is it's supposed to like maintain a heart that's failing. So keep it in the normal range of not only contractility and how strong it squeezes, but it's also supposed to maintain a rate in which is like a normal rate. We say 60 to 100. I don't know why with overdose, their rates skyrocket. All I know is, yes, we cardiovert patients that have dig toxicity. And believe it or not, calcium chloride or any calcium is contraindicated on patients that take dig. Okay. Calcium is contraindicated for these patients. Number 6, child most likely presents with, Down syndrome. Just by the appearance. We can tell that
Moon face, yep.
Yeah, we can tell this is Down syndrome. Number 7, which of the following drugs are indicated in hyper K? Select 2. This is one that I don't like, by the way. What do you guys saying?
I'm saying A and E.
You said E as an echo?
Yeah, E as an echo.
Okay, so you're saying which of the following drugs are indicated for hyper K? So there are actually 3 drugs here that are indicated for hyper K. And I know it's saying pick 2, kind of like defeats the purpose. That's kind of odd. But actually it's the first 3 are
I
indicated.
was gonna
with
say,
hyper
that's what I
K.
thought. Yeah.
First 3, right?
Yep.
Calcium gluconate can be given. Sodium bicarb can be given, and albuterol. Now, remember, your patients that have hyper K, this is an increase in potassium.
But
So
does
when you,
vasopressin excrete potassium?
so the whole reason why, well, yeah, why if it excreted potassium, why would we want to give a vasopressor? What's going on with potassium is there's too much in the blood, and we need to get it back, right? So we need potassium inside the cell. We don't need potassium outside the cell floating around. Now, how do we get that thing back into the cell? Well, there's only one drug on here that would cause that, and that's albuterol. Giving patient albuterol will help absorb potassium back into the cells. You can also give things like dextrose and insulin together. Because remember, if you give dextrose, their BGL is going to skyrocket. But if you give insulin, it comes back down. And by doing that, you'll allow these cells to become more permeable, and potassium will leak back into those cells. Calcium gluconate and or chloride actually stabilizes the heart, the myocardium. And the reason why we say, hey man, why do we need to stabilize the myocardium? Well, if we have hyper K or increased potassium, that potassium is going to get to the heart and it's going to cause a heart failure. It's going to cause a dysrhythmia. Now, I'm sure you've all have heard people say like, oh yeah, I'm going to put my dog down. What do you think they're using to put your dog down? They're using potassium. Okay. That's all it is. It's a lethal injection of potassium, and the heart will fail or throw a dysrhythmia once the potassium reaches the heart. So calcium is used to kind of like counteract or maintain a strong or healthy heart. Bicarbonate is also used in patients with hyper K. Okay, very common to see sodium bicarb get used for hyper K patients. These patients typically have a acidotic. They have other poisonous chemicals, myoglobin, and different things that break down inside the bloodstream. So sodium bicarb stabilizes the pH within that bloodstream. But those are the 3: calcium, sodium bicarb, and albuterol that should be used for hypertension patients.
Would that answer be just A and B, or?
It should be A, B, and C.
Yeah, it should be. Yeah.
Yeah. I do have the answer key here. Let's see what they wanted. They wanted B and C, even though dude, that's what they wanted. But I mean, look up any literature. Calcium gluconate and calcium chloride is 100% indicated in patients who with hyperkalemia. All right, so we got an EKG here. It's our first one. EKG monitor shows this rhythm. Which of the following statements is correct concerning this rhythm? On number 8.
C.
Alpha.
So before we even answer it, can somebody tell me if these are unifocal or multifocal PVCs?
Multifocal.
Okay.
Multifocal.
Yeah.
Right. We know these are multifocal because they look different, right? They do not have the same appearance. Now, understand, all PVCs means is that there is an irritable site. There's something wrong within the ventricles that's causing these things, especially they're ectopic, right? They're coming from different locations. So you could have a heart that is, I don't want to say weak, but irritable. Okay. So A is the correct answer. We just have 2 sites in the ventricles that are irritable and firing off. Okay. Remember, if it is unifocal, they will always look the same. And what's funny is about D is it says the ectopic foci, which is the right terminology to say, hey man, it's occurring in different locations, but then it says they're unifocal, which that would not happen if they are ectopic foci. Number 9. Okay, number 9 states, in which of the following conditions does the body's immune system attack the myelin sheath?
A.
A.
All right. A is correct. MS. MS is definitely correct. Remember, all that's happening is the myelin sheath, it's like a coating that protects your nervous system, is wearing out with MS. This is an autoimmune disorder, so it means that your body is literally attacking your own self, and it's breaking away at this myelin sheath. These patients with MS will have nerve damage, and it kind of disrupts communication between their brain and wherever those nerves are headed. No bueno. Number 10. Which of the following describes a degenerative condition of the electrical conduction system of the heart that is characterized by bradydysrhythmias and tachycardias? Tachydysrhythmias.
Bravo.
Bravo.
Yep.
Good. Six sinus syndrome. So all six sinus syndrome means is, yeah, there's a plethora of dysrhythmias out there. And if they are related to the sinus atrial node, then yes, those are sick sinus syndromes. Number 11, which of the following are toxidromes? Select the 3 answer options that are correct. Toxidromes.
The last 3?
Yeah, so there's 3. Which ones did you say?
The last 3?
The last 3 are correct. Okay, so there's a lot of
sorry, I was gonna say,
No,
aren't anticholinergics and sympathomimetics the same thing?
No. Nope. Let's talk about that, because that is actually a very good question. Before I answer that question, let's talk about other toxidromes that are out there. Remember, these toxidromes are medications that can be potentially poisonous, right? We're talking about anticholinergics, cholinergics, opioids, sedatives, sedative hypnotics, sympathomimetics, right? Also known as adrenergics or stimulants, right? These are all different toxidromes. Now, talking about anticholinergics. Anticholinergics are there to stop the process of a parasympathetic neurotransmitter called acetylcholine, right? So we have a neurotransmitter called acetylcholine. Go ahead.
Okay, so, no, to say, well, right, because I know that, or you can correct me. Sympathetic is considered adrenergic, right? And
Correct.
parasympathetic is considered cholinergic, and so anticholinergic is not going to let the effects of the parasympathetic system, which is why I was able to say, all right, if it's a sympathomimetic, which it mimics a sympathetic, and anticholinergic, which means it inhibits the cholinergic effects. That's what I meant by saying they're the same thing.
That's actually awesome that you realize that they're going to have similar effects, but they are 100% different, even though they're both going to possibly increase rate, right? If I say a sympathomimetic mimics a sympathetic nervous system, that's adrenaline, right? It's going to squeeze the blood vessels. It's going to increase inotropy. It's going to increase chronotropy, right? These are all things of the sympathetic nervous system. But if I said, hey, man, we got acetylcholine, that if acetylcholine reaches my heart, it's going to cause a parasympathetic response of lowering the rate. It has nothing, an anticholinergic's never going to squeeze my blood vessels. You know what I'm saying? But all it's going to do is stop that acetylcholine from basically reaching that target location. That's it.
Okay. So, and in which acetylcholine is the one that is considered a cholinergic, which has similar responses to the parasympathetic system. So what you're saying is that anticholinergics won't allow the parasympathetic system to be activated, but it doesn't mean that it's going to activate the sympathetic system.
So remember, if a cholinergic effect happens, right, we have, let's say, an increased spike in heart rate or whatever the case might be, A sympathomimetic response can not only increase rate, but again, it's going to have effects on pressure as well. So it's
Okay.
just going to include other forms. Now there's a ton of things in your body that can increase rate and have very similar effects. Same thing with hormones, right? Hormones can do that as well. But but yes, talking about cholinergic, man, we're talking more like norepinephrine, right? But remember, anticholinergic, those are part of your parasympathetic whenever we think of that. Number 12, which of the following are infectious diseases of the heart? Select 3 answers that are correct. That's number 12. What'd you guys put?
I put A, E, and F.
That is right.
Is
A,
that
E,
it?
and F. Endocarditis, inner layer of the heart, has inflammation. Pericarditis, the outside portion of the heart, has inflammation. And myocarditis, the heart's muscle, has inflammation. Good.
That's what I would have answered with too, because itis means inflammation.
That's it.
So you can,
And
you
we're
can
talking
rule it
about
out that way.
infectious disease.
Good way to
Whenever you
break it
think
down.
infection, yep, that's good. Whenever you think infection, man, always think inflammation. That helps. Number 13, teenager overdosed on haloperidol. Remember, Haldol is a
Lithium, right?
antipsychotic. It's an antipsychotic.
Lithium,
He
right?
presents.
Excuse me.
What's up?
Isn't that lithium?
I don't know. Let's take a look. Is Haldol lithium? It says Haldol is superior to lithium for treating severely ill acute mania.
Okay.
So it doesn't
I
sound
know.
like
I
it
know. I
is.
had read somewhere that they were like some sort of combination with them. That's why I asked.
Yeah, it might actually have portions of lithium in it. But anyway, so we know that this is an antipsychotic, right? This patient presents with some weird ass words. Opisthotonus, or whatever the hell you would say that. Spasmodic torticollis. This and these type of questions, man, they're trying to test your ass on your knowledge on medical terminology. Now it's funny because if I go ahead and look up each one of these words, and I know on the National Registry, you won't be able to. So you would have to know by just looking at the test question what it's asking. But take a look at this patient here, man.
Oh my goodness.
Brutal, right? It looks like somebody is literally
What the fuck?
this is crazy. It's like somebody's
Looks like an
straight
exorcism.
It does.
Yeah, it
looks
does.
identical to an exorcism. Now what's interesting is all of these that they're telling you that this patient's experiencing is a muscular contraction, right? So based on the patient's presentation, your pharmacological differential diagnosis suggests he overdosed with what did he overdose with?
I would say
Antipsychotic.
B.
Yep, antipsychotic. Now, my next question is, we call that, those reactions, we call that dystonia.
Estonia.
Correct. That is
Damn,
a
I did learn.
dystonic. That is a dystonic reaction. Okay. That is a dystonic reaction. So how do we treat dystonic reactions?
Is it Benadryl?
It is Benadryl. Nailed it.
Damn, I do study.
It is Benadryl. So give 50 milligrams of Benadryl IV, and it should relieve those contractions. Your patient's not in an exorcism. Or maybe they are. I don't know.
Excuse me.
Chemoreceptors. Number 14. Chemoreceptors are found in the they are found in the
Medulla
oblongata. Exactly right. Okay. Medulla oblongata. So if we remember, this is straight up anatomy talk. Sorry to do it to you. Chemoreceptors are receptors that are looking for chemical compounds, and these chemical compounds are extremely important for breathing. Okay, one of these receptors are looking for pH, they're looking for CO2, and they're looking for oxygen. So when we say, hey man, my CO2 levels are stacking, right? And stacking, we know 35 to 45 is considered normal, but when my CO2 goes high, my medulla oblongata says, hey dude, we need to breathe faster because we need to get rid of that shit, right? We got to breathe it out. Those are chemoreceptors located in your brainstem to make you breathe. Good test question though.
Excuse me, sir. I was
Go
gonna
ahead.
ask, how does that differentiate from the pneumotaxic center? Because doesn't the pneumotaxic center do the same thing with like
Yeah.
CO2 buildup?
So let's take a look. I'm wondering if pneumotaxic center is located in the same location. Where is pneumo?
I would have
Center.
picked. I would have picked that one.
That is in the upper pons. Terminates inspiration, thereby regulating inspiratory volume and rate. So that's located in the pons. I'm wondering if the chemoreceptors send messages to the pneumotaxic center to create that. I'm trying to think how I can write that. Because even, let me see in that test questions, pneumotaxic center and pons were both on here. And again, the pneumotaxic center is located in the pons. So I wonder if chemoreceptors are not even located in the pons. I can Google that. Are chemoreceptors pons? So it says in the medulla between the facial, okay, most likely located in the nucleus in the rostromedulla between the facial nucleus and the lower pons. So yeah, so basically what this is saying is that chemoreceptors are located in the medulla below the pons.
Yeah. Okay.
So that's the only difference there is the location of those chemoreceptors. But that's awesome, Jonathan, that you remember that, because that is a good eye. 15. Which of the following patients is at greatest risk for electrolyte imbalance?
B.
Bravo.
B.
Bravo is the one with the most risk for electrolyte imbalances, and that's based on dialysis treatment.
Hyper K.
Hyper K, right? Which is an electrolyte. And that's not the only electrolyte that can get thrown off, right? So there's a lot that goes on when people are when their kidneys are failing, they're unable to filtrate blood. Remember, electrolytes get used throughout your bloodstream. It's going to throw everything out of whack. Number 16, which of the following conditions are autoimmune disorders? Select 3 answers that are correct for number 16.
A, B, and C, I think.
A, B, and C are correct. Remember, autoimmune disorders are disorders that attack your own body. Knowing that an abscess is like something that grows inside somebody's mouth and it looks like a large pimple. Vaginitis, okay, we know that that's going to be inflammation or swelling. And then tetanus, we know you can get tetanus from bacteria that stepping on a nail or something like that outside. All of those have nothing to do with autoimmune disorders. Which of the following acid-base disorders is characterized by carpal pedal spasms? Carpal pedal spasms.
Respiratory acidosis.
Is that respiratory alkalosis?
Alkalosis.
Oh,
Alkalosis. Good. So remember this, when somebody is breathing too fast, they're blowing off their CO2. CO2 levels lower. These patients are typically having some sort of an anxiety attack, or they're just hyperventilating. Carpal pedal spasms are a normal thing that we do see out in the field. Remember, we're just trying to get these people to calm down, slow down their rate of breathing, and try to bring up their CO2 levels. Respiratory alkalosis. First 12 lead. 72-year-old is complaining of chest pain and difficulty breathing. EKG shows this rhythm. What do you guys think it is?
An inferior wall STEMI?
100%, Ali. It's an
Yep.
inferior wall
2-3
STEMI.
AVF. Yep.
Yep. Do we have reciprocal change?
Yes.
Where do you see reciprocal change?
Oh
for
wait,
2,
no, I
3,
don't
AVF?
either. 2-3.
1 in
So
AVL.
let's take a look. One in
lateral?
AVL,
Yeah.
right?
Oh,
do
yeah,
we
I can
see,
see it now.
do we see depression in 1 in AVL?
Yep.
Absolutely do, right? We got positive reciprocal change. We know that this is a inferior wall STEMI. Remember, with inferior wall STEMIs, these hearts are right-sided dependent. Be careful on giving vasodilators because you will lower that preload. And remember, if you lower preload on somebody who has a right side of their heart that's already dying or damaged, you can cause some serious decrease in hypotension. Just be mindful. Number 19, which of the following EKG leads are associated with an inferior wall? We just said it, 2-3 and AVF. Number 20, which of the following vessels receive deoxygenated blood from the veins of the myocardium and empties into the right atrium? This is an interesting one. What do you guys think?
Charlie? Inferior vena cava.
That's what I would think too, right? The second I'm reading this question, I'm like, oh, dude, well, we all know the superior and inferior vena cava, they dump into that right atrium, but
Coronary
you
sinus.
missed part of the question. Which of the following vessels from veins of the myocardium? So these are veins on the myocardium. They're not veins. These are not large veins that are coming from systemic circulation. This is actually called a coronary sinus. This is literal blood flow that is coming from the heart itself into the right atrium. So trust me, the first time I read this question, I was like, oh, dude, vena cava.
That's some bullshit.
I know, it got me big time. I was laughing though. So yes, it says coronary sinus is a collection of veins joined together to form large vessels that collect blood from the heart muscle itself. It delivers deoxygenated blood to the right atrium, as do the superior and inferior vena cava. So good question. Number 21.
What was the answer again? I'm sorry.
Coronary sinus. Bravo. Number 21. Which of the following drugs produce inotropic effects on the myocardium? Okay. Inotropic.
I put Bravo, Delta, and Foxtrot.
Foxtrot. The other ones are good. Foxtrot, no. Remember, what is Foxtrot doing? What is the Foxtrot?
A blocker.
It's a beta blocker.
It's a beta blocker. And what do beta blockers do? They block contractility. So remember, beta agonists, something that is a beta agonist is going to increase rate and increase strength. If I have a beta blocker, it's going to stop that from happening. Now we look at some of these other answers. We got ketorolac, which is a NSAID, non-steroidal anti-inflammatory drug. That wouldn't be it, right? Hydralazine. I don't know why I can't think of what hydralazine is. Hydralazine is an antihistamine. Okay, antihistamine definitely wouldn't do that. The answer, first off, calcium. Always remember this. Calcium as an electrolyte is used in your heart, because remember, you got calcium, you got potassium, and you got sodium. Calcium as the electrolyte increases contractility. So somebody who has low calcium can have a problem and throw dysrhythmias or have heart failure. So calcium is really important. So calcium is one. The others are dopamine, which is for obvious reasons, and then DIG. So yes, you are right on those. Calcium, dopamine, and dig were our 3 drugs that will have a inotropic effect. Remember, inotropic just means contractility, strength, and contractions. How about this lady, man? She ain't doing good. Patient's likely to present with what?
B, isn't it?
Angioedema.
Angioedema. Remember, angioedema,
Oh, yeah,
swelling
yeah.
of the tongue and lips.
That's
That's
right.
an allergic reaction, man. Not good.
Real quick, sir.
Yes.
Question about 21. Will the question always say select the 3 answer choices that are correct, or can it say select all that apply? Can they word it both ways, one way? How does that work? Because I haven't taken a test where I've had that kind of question asked.
Right. Well, to be honest with you, I am hoping that the National Registry isn't adding anything like this. Now, I heard through the grapevine that they are.
They are.
And the reason so I heard that because the National Registry was known so much for giving too many right answers, that they started to include these types of questions, which could potentially be a good thing, right? To say, hey man, all 3 of these answers sound amazing. These other 2 are dumb. Maybe it might make it easier, but I know when I took the National Registry for Paramedic, I took it last year, and they did not have anything to do with select multiple answers in one question. So this is something new that they've been discussing. So we're prepping for it.
My friend just took it and he said that they had to select all that apply. And that was
Yep.
about like a month.
Great. What did your friend say about the test? Hard, easy, where the select all that apply sucked?
He actually didn't mind it too much. He thought that it helped him more than anything, but he was also the top of our class and really smart. So
that helps. But yeah, this is like a good way though to study, even if it wasn't, those type of questions weren't there, just to like know, hey man, these are different things that can potentially have the same effects, and definitely a good way to look at it. All right, let's take a look at number 23. Number 23 states aspirin is contraindicated in which of the following patients?
The Delta.
This one's gonna mess you guys up. He's all right.
Okay.
Ginsburg says
is it Bravo?
it is Bravo, which is wild, right? To look at Bravo and be like, wait, what? This kid's having an MI. We're not going to give him aspirin. Believe it or not, the FDC states aspirin is not indicated for anyone under the age of 19. That's from the FDC, which is crazy that, that aspirin, such a wild age that we can't give aspirin to anybody who's young. But that's the whole purpose behind it, is the age. Okay. It's the age. Number 24.
Cocaine
21-year-old.
doesn't have anything to do with it.
What is that?
Cocaine wouldn't have any negative effects.
No,
Alright.
not really. Typically, so if you ever have a patient with chest pain from cocaine, it's not contraindicated to treat them for the chest pain. You're actually supposed to treat them for the chest pain, but you're also supposed to be giving them a benzo. Okay. So typically a benzodiazepine is one of the first things I would do for a patient that's on cocaine that I think is overdosed. But then, yeah, you're also going to treat for chest pain. Same thing with nitro and all that stuff. So 21-year-old presents with severe respiratory distress, is the driver of a motor vehicle that crashed into a tree at a high rate speed. You find deformity of the chest wall with flail segments. His respirations are shallow. Based on the patient's presentation, what is your acid-base disorder? Differential diagnosis.
Respiratory acidosis.
Mhm.
Absolutely. Good. Respiratory acidosis. Now, what gave that away?
Breathing slow.
All right. Shitty breathing, right? If I say breathing is not adequate, then we say this is potentially acidotic. This patient's retaining. They're not able to get the CO2 out. Good. EKG monitor shows this rhythm. God, this is
Inferior
driving me nuts.
STEMI.
They're showing same shit. Yep, good. What do we also note on there's some other action going on here.
Oh yeah, there is.
What else do we got going on in there?
3, 4, and 5.
4, 5, and 6.
Yeah. 4, 5, 6.
All right, there's a lot
Wouldn't
going
that be
on.
endocarditis?
All right, so if we were talking about typically pericarditis, right? Any of these, when we start having inflammation of tissues, we would have it in all leads.
Yeah.
Now, seeing that this
Right.
is in other leads, now the only thing that really doesn't show me that, hey, this is potential is that's not all concave, right? So that's the first thing I would look at. Now, I do have some concave here in 2. AVF and 3 are kind of like, I wouldn't even call this convex. I do have a little bit of concave here and V6. And look at these. These are all V6Rs. V6, V5R, V4R. So this, whoever did this 12 lead, they're saying that they moved those over to the right side. So this is showing that we have right side involvement on this heart. But the fact that it's all convex, the majority of all these elevations are convex versus concave, makes it, this is a STEMI. But good call. I recently had a patient that had ST segment elevation in several leads, and the shape of the ST segment elevation is what gave it away. Well, also the patient wasn't complaining of anything heart related. No, I don't have any chest pain. Like what? No, the guy didn't look like he was having a heart attack or anything. But then I printed out his EKG, and I was there for a fall, so the guy fell down. I was like, dude, man, you don't see a cardiologist. And for those of you who are kind of confused on my discussion on convex versus concave, all I'm looking at is for this ST segment. If I see a concave shape that looks more like a half pipe, or a smiley face, that is usually indicative of early repolarization. It could also be pericarditis, but typically with those, whenever I see these concave shapes, I'll see it throughout the entire EKG. Okay, so just be mindful of that. If I start seeing what's known as convex, which means that J point makes an immediate turn, it doesn't like U, it does like an immediate turn. So my Q or QR S J point, and then it just creates a different route. This is called a convex appearance versus concave. So again, this one's a little bit concave, but not so much. So that's why I would say we're looking at a STEMI here. The answer is A. That is a good discussion. Number 26, child is apneic after being submerged in a lake. You oxygenate, ventilate, and intubate. You should next
Administer bicarb.
So interesting question, right? I changed one of the answers, by the way. If you guys see on your test, C on your test said nasal tracheal intubation. I was like, what? Why would you nasally tracheal intubate somebody when they're already intubated? I put nasogastric tube there. I think that's where they were going for, because that would be
Suction.
the answer. You're going to suction. Yeah. This patient drowned. Now, Allie, you mentioned sodium bicarbonate. Sodium bicarbonate would 100% be something I would consider, seeing that this patient's not only apneic, but they were also submerged in a lake. They did not give any time, right? There's nothing in this test question that says it's been for a prolonged period.
I was grasping at straws for that nasotracheal, so I felt like that was the only one to go for.
No, yeah. For your guys' test, when I read it, I was like, bicarb definitely sounds like the best answer, but they don't give enough information. To me, I was like, I'm pretty sure they were considering nasogastric tube versus intubation, because they already said the patient was intubated. So I just changed it. But you are right. If that was how it was written before, this would have been the best answer, administer sodium bicarb. But they didn't give enough information for me to be giving bicarb to this patient. All right. We got, which of the following are actions of Lasix? Select 2 answers that are correct. Following actions of Lasix. This might be, go ahead.
I'm sorry, would it be A and B?
27. A and B. Good.
Yeah.
27 is A and B. So we know that it first off increases urine output. Everyone can agree with that on a diuretic. Now, knowing what furosemide does, it says it reabsorbs sodium and chloride within the kidneys. And by doing so, it increases urination or increases water, right, to be drawn in through those kidneys and out to be excreted. So inhibits the reabsorption or slows down the absorption of sodium and chloride. Good. Number, let me see if I wrote anything here as a note. Diuretics will inhibit the reabsorption of sodium and chloride in the kidneys. By doing so, it will increase sodium and water excretion. Lasix will definitely reduce preload though. So that was something that I was kind of like saying that C was to me a good answer. You know, because we know that if I give somebody Lasix, Lasix will lower blood pressure, right? It will reduce preload over time, but it doesn't have the same effects on afterload as it does on preload. So that's what made A and B the best answers. Number 28, which of the following actions of dexamethasone treats anaphylaxis? So first off, if you never learned about dexamethasone, I don't expect you to be able to answer this question or to feel confident answering this question. But is there something about that drug that you know its classification? Anybody? What classification is dexamethasone? By just the name itself.
Dextrose.
Nope.
Is it
Think of,
corticosteroid?
what'd you say?
Corticosteroid.
It's a steroid. Yep.
Mm.
Zone, right? When we think of
yeah.
methylprednisone,
Oh, shit.
that's, you know, when we think of steroids, we could kind of rule into this, hey man, this is a steroid is what they're talking about. Now, the answer is B, suppresses acute inflammation, and it also produces immunosuppressive effects. This is why people take steroids.
Makes sense.
Right? Long periods of times. These patients that have like autoimmune disorders, they'll be on steroids for long periods. Immunosuppressive effects to it. Number 29, which of the following is a primary neurotransmitter of the parasympathetic nervous system? We talked about this earlier.
Sorry, I was doing something. What was the answer to 28?
Number 28 was Bravo and Delta.
All right, thank you.
Is 29
Yep.
Charlie?
D.
29 is Delta, acetylcholine.
Yep.
Remember, parasympathetic.
Yeah.
Whenever we talk about neurotransmitters of the parasympathetic nervous system, you always have to think acetylcholine. Acetylcholine. Number
Quick
30.
question. When I
Yes.
talk, when I have my microphone unmuted, do you guys have an echo of what you're saying, sir?
Nope.
All right. Thank you. Sorry. Like I said, I'm
Yeah.
on a
No,
vacation.
you're good. Zoom is usually pretty good about that. They're able to like suppress echoes and all that.
All right. I just didn't want to be rude. Thank you.
No, you're good, man. All right, we're getting into our first math questions. First thing that I want to tell you guys that you're going to be excited about. I know anybody that's taken my class, you guys know that we use calculators. Your national registry will also provide you with a calculator. Makes your life so much easier. So let's take a look at this. It says you ordered a medication, or I'm sorry, you were ordered by medical direction to administer diazepam, also known as Valium, 0.3 milligrams per kilogram to a child who weighs 66 pounds. Drugs prepared in 10 milligrams and 2 mLs in a multi-dose vial. Which of the following is the correct amount to administer? So first thing we got to do is we need to figure out what is the kilograms. So I'm going to take the number 66. You guys can see my calculator, by the way, right?
Yep.
All right, good.
2.2.
Divided by 2.2, that gives me 30. So now I need to multiply 30 by my dose. So I'm going to go ahead and multiply by 0.3. That gives me 9. So 9 milligrams is how much I need to give to this child. But if I look at how it comes packaged, 10 milligrams and 2 mLs, by just looking at this, at the answers that they're giving me, I already know the answer, right? I don't even have to continue doing the math. But if I wanted to continue doing the math, just for those of you who it's been a while, all I'm going to do is take that number 9. I'm going to divide it by how much milligrams I have in that vial, which is 10. So divide that by 10, and then multiply it by the amount of mLs times 2. 1.8 mLs is what I need to draw up. The answer is C. I know that sounds like a lot. Don't worry, I'm going to do 2 more here. Hopefully, if it's been a while and you're having a tough time with this, it's not too bad. How you doing there, Mike? You all right?
I was just like, what?
All right, let's do another one. We're ordered by medical direction to administer etomidate, okay, to a patient who weighs 154 pounds. They tell us what it comes packaged in. So this one I use often, right, in the back of my truck. Somebody throws me an etomidate, I take a look at it. It's 40 milligrams and 20 mLs. Now I need to figure out how many mLs am I going to draw up. But before I even try to figure that out, I got to know what my patient's kilograms are first. So I'm going to take the number 154 and I'm going to divide that by 2.2. That gives me 70. So now I know I have 70 kilograms. For me to figure out what my dose is, I now need to multiply 0.3, because that's what they asked me, 0.3 times 70. 0.3. All right, so now I have a dose. The dose that I have is 21 milligrams. So I need to figure out, hey, dude, how the hell am I going to draw up 21 milligrams
See,
to this patient when my thing comes packaged with 40? Well, easy math for all of us would be like, well, shit, I know 20 is half of 40. So I know how much I can draw up to obtain half. And obviously there's only one answer here that's close to half.
Yeah.
All right. That's probably the easiest way. Right. But I'm going to continue this math problem just to show you how it gets done. Now I have this number 21. Follow me, Mike. So what I'm going to do with it is I'm going to divide it by how much milligrams I have in my vial. So I'm going to take 21 and I'm going to divide that by 40. Gives me this crazy ass decimal. There ain't shit I can do with that. But to obtain how many mLs I need to draw up, I now need to multiply that number by the amount of volume within that vial, which is 20 mLs.
Oh, okay.
Watch this. Times 20. 10.5
Check that shit
mL.
out. Damn, that's cool.
Check that shit out. Okay, let's do another one.
I'm old, y'all.
You're ordered
hey, it's
by
not me
medical
anymore.
direction. It's not me anymore. You're ordered by medical direction to administer
It's
6
always you,
milligrams
Chris.
of atropine. That is a shit ton of atropine. Holy, you know what the hell's going on here, right? Not good. Drug is prepared 8 milligrams and 20 mLs. Which of the following is the correct amount to administer? So let's do it again. What's nice here is they didn't make us take out a weight.
No
Easy
way.
move, right? So all I do is take the number 6 because that's how much they asked me to give. Now, remember what I said. We have to divide it by the amount in milligrams that's inside the vial. So I'm going to go ahead and hit divide by 8 milligrams. And now I need to multiply it by what?
20.
20.
By 20 times 20. There's how many mLs I need to draw up.
Yeah, that's easy.
And this
Yeah,
is
it's not bad at all.
organophosphate poisoning kind of dose,
Yeah,
right?
definitely.
Yeah, exactly right.
All the
Good.
atropine you can throw at it.
Yeah, that's it. We're trying to achieve atropinization. Some crazy ass term they call
Fancy
it.
word.
Yep. Number 33. Which of the following are characteristics associated with bacterial meningitis? Not good. Number 33.
Mm,
D,
So
E, and F.
yeah.
if I heard you right, Rubio, did you say Delta?
Charlie, Echo, and Foxtrot.
Perfect.
That's what
Charlie
I
Echo
heard
and
too.
Foxtrot.
Yep.
Correct. Nuchal rigidity, classic, right? Not
Mhm.
long ago, did I have a call that came in as an 8-year-old that can't move his neck. And I remember walking up to the house and there was a cop trying to race into the house and I stopped him and I was like, hey man, if you don't mind just waiting out here, let us evaluate this kid because God forbid this kid has meningitis. It won't look good. You walking around with no mask on or anything. Remember, meningitis can be very contagious. Number 34, which of the following is a characteristic of platelets? Kind of a tough one. We can kind of break it down a little bit, right? Process of elimination. We know that platelets deal with coagulation, right? It's a component in blood, right? Now, if I look at this, are the site of sickle cell disease, that makes 0 sense. So
Yeah.
that's going to be a no. Next one, also known as erythrocytes. That's a no because erythrocytes are what? Red blood cells,
Red blood cell. Yeah.
right? So we can toss that. Next one, normal platelet count is either 20,000 or from 20,000 to 50,000 per microliter, or are derived from stem cells. We're kind of doing a 50-50 here.
say
The
C.
answer is bravo.
Is it really?
Stem cells, yes. So
Hmm.
stem cells are
In the
building
marrow,
blocks
right?
of cells. So that's all stem cells are. They're building blocks. So they can create many different cells. They can create different tissues. Stem cells can create different components of blood. That's what stem cells are for. All right. Phosphodiesterase inhibitors. Whew, that's a big word. What are those used for?
B.
I think it is B.
Erectile dysfunction. Okay. Erectile dysfunction. And how I always remember that is from American heart classes. You know, whenever they talk about if your patient takes phosphodiesterase inhibitors, like, well, I remember the first time I ever heard that term, I was like, what the hell is that? Because remember in ACLS, they talk about STEMI and how to treat a heart attack. And we always have to ask for ED drugs before providing nitro. Number 36, which of the following statements is least correct concerning electrical burns? Least correct. Got to know a little bit about electricity to answer that question. The least correct answer here is delta. Okay. Delta says most electrical current cannot penetrate body tissues. That is 100% false,
Oh,
right?
okay.
Because
I read
you
it
are
wrong.
a conductor,
Definitely.
right? You're a conductor. Now, talking about a couple of these other ones, taser injuries require EMS or injuries. Taser injuries require emergency medical care. That is true. Taser injuries can actually be pretty bad. Flash burns is a type of electrothermal injury. This is true as well. Flash burns are obviously a thermal trauma. And then this other one, alternating or AC current, is more dangerous than DC current. First off, you got to know what it is, right? For you to even answer that question. AC current just means that it's alternating between positive and negative currents. Now, when we look at electric lines that are powering your city, those are run off AC current. Typically, if you have DC current is used for like very low voltage, maybe charging batteries. You'll see DC current being used in like automobiles to power like lights and stuff like that. It's not high voltage. So the answer for looking at A says alternating current is more dangerous than direct current. The answer, that's true. It is. It's a lot more voltage. D is the answer. Number 37. Which of the following are antidysrhythmic drugs? Antidysrhythmics.
DEF.
DEF.
Yeah,
Good.
definitely.
DEF. A lot of people, they don't talk about procanamide much, and I don't blame them. But at the same time, is procanamide making a comeback? Fortunately, it is. Sorry to tell y'all. One more drug that might get thrown into the mix of talking about American Heart Association.
Mike, isn't Ditch
Yep.
also anti-arrhythmic?
No, DIG would not be considered an anti-dysrhythmic. DIG, let me see what they're classifying that as.
Is that a big beta?
It's a, oh, it is pronounced as an anti-arrhythmic and blood pressure support. Let's write, is DIG anti, guess they really want to call it an anti-arrhythmic. No exam of medication used for an anti-arrhythmic. Yeah, I guess it is. It's a good call. Because yeah, it does get used to treat some dysrhythmias such as AFib. So that's a good point. Methylprednisone is solumedrol. Atropine is an anticholinergic. So yeah, I guess DIG would be a decent answer. These three are definitely the most common that get discussed in paramedics though. But good point, Ginsburg. Number 38, which of the following describes the ligament shape like a cross that supports the atlas vertebrae?
Charlie.
All right.
Spanish, cruciform.
Cruciform ligament. Let's take a look at it, man, just so you guys can see what it looks like. Where's a good photo of it? Look at this. It looks like a cross, right? So yeah, if you know crucifix, cruciform is a cross, right? And that is the correct answer. C. Which of the following types of radiation has high energy with extensive penetrating power?
Gamma.
Gamma, 100%. 100% gamma.
What
If you remember that photo, go ahead.
What was 38 at? Sorry, I had to run into the other room.
No, it was C. Cruciform,
Okay.
like crucifix.
Okay.
Cruciform. So if you remember that photo talking about radiation, alpha radiation will literally bounce off of like clothing and had very little penetrating effects. When we said beta would go through clothing, but it would bounce off objects. Gamma goes through everything, right? Except for like lead. This is why gamma radiation is the worst, and that's what they are using in X-ray technologies. Pheochromocytoma. Pheochromocytoma is a condition of the adrenal gland in which a tumor produces excessive release of
C.
This is a contraindication to, I can't remember which drug. Oh, damn it.
Number 40. So first off, we got to know what the hell.
What the fuck?
That is an angry dog. We got to know what the hell gets generated in the adrenal glands, because we're talking about what this condition is, right? When we look at this condition, there's only, because that would be the hardest part, is to be like, yo, what is this condition even caused from? Now, pheochromocytoma is a rare benign tumor that develops on the adrenal gland. I'm telling you right now, if you didn't know that, which I know I didn't when I was reading this, I would have been screwed, right? It would have been a 100% guess. So knowing what gets created or what kind of hormones are excreted from the adrenal glands, does that make it any easier?
Isn't it the growth hormone?
That's what I was
Nope.
thinking. No.
Nope. It's actually epinephrine.
Epinephrine, that was my next guess. Okay.
Uh-huh. So let's talk about some of the hormones that get excreted from the adrenal glands. First hormone that gets excreted from the adrenal glands is cortisol. Whenever you learn in paramedic school about, hey, we get too much cortisol. Do you remember what that disease process was called? It's also from a tumor.
Is it Cushing syndrome?
Cushing syndrome. So moon face, buffalo hump, these people have excess body fat. Absolutely. So cortisol is used to help regulate carbohydrates and sugar and fats. Also deals with your circadian rhythm and your sleep patterns. Another thing is aldosterone. Aldosterone plays a very important role in blood pressure. Okay, your sodium potassium pump. This means aldosterone regulates blood and your pH. Okay. Another thing that gets secreted from your adrenal glands is epinephrine and norepinephrine. Okay. Remember, your stress hormones all come from your adrenal glands.
Yeah.
Do you happen to know which cardiac drug this is the contraindication for? Because one of them it is. I can't remember. It's just bothering me.
What, pheochromocytoma?
Yes, sir.
Let's see.
Ketamine.
Ketamine's on there.
No, I'll find it.
Yeah, curious what it is. What kind of chart are we looking at here?
pH scale.
100%, man. That's a pH scale all day. How about number 42? What are we looking at here?
Oh, goodness. Let's see. Lymphatic, no.
Nope.
Microcirculation.
That's exactly right. Because look, we're looking at venules. So
Yeah.
we're looking at, these are blood vessels, right?
Yeah.
And when blood vessels get closer and closer and closer to tissues and skin, it turns into microcirculation. This is where diffusion kind of takes place, right? A lot of these micronutrients, oxygen offloads into tissues through microcirculation. And that's kind of the depiction of it that you would see in textbooks. Which of the following are appropriate routes by which to administer diphenhydramine? How could we give it?
Alpha, Charlie, and Delta.
Okay, he says alpha. Dude, you would take Benadryl orally? Nope. Benadryl.
No.
So Benadryl, actually, you know what's funny is that you would take Benadryl orally from a over-the-counter medication. So I can't say that, right? Because yeah, you would take it orally, but we would never give an EMS oral Benadryl. We would give it intravenous, and anything I can give IV, I can also give IO. So those two have to be together. And then the other one is intramuscular. But yeah, this is another question that I think, Ginsburg, you're on it, dude.
That's a good one there.
That is a good one because you could take it orally, right? Over the counter.
Yeah.
We just would never give it orally. So technically to say it's an appropriate route, it should be appropriate. You would just never spray Benadryl in somebody's mouth. It would have to be in pill form. What's this photo that we're looking at? It says 84-year-old presents with disfigured phalanges. What would you call that?
Osteoarthritis.
Absolutely. That's osteoarthritis right there. And osteoarthritis, because some people are going to ask like, yo, what's the difference between osteoarthritis and rheumatoid arthritis? Remember, rheumatoid arthritis is a autoimmune disorder, right? And now when we think about osteoarthritis, this is the most, believe it or not, common form of arthritis. Involves of wearing down of cartilage around the joints.
And it's not autoimmune, correct?
Correct.
Yeah.
Just wearing down of those joints. Number 45. EKG shows this rhythm. That ain't good. What would you call that?
I say D.
D.
Yeah.
How do we know that it's not sinus?
No P wave.
No P wave.
No P's and also widened QRS complex, right?
Mhm.
Yeah, makes it idioventricular. Number 46. Which of the following are characteristics associated with PVCs? Associated with PVCs. So, first
Echo.
one, okay, echo for sure, right? Echo says are considered ectopic, right? We talked about this earlier because they
Yeah.
originate other sites other than the SA node. Absolutely right. E is 100% right. The other one, believe it or not, is
E.
Bravo.
Ischemia.
Ventricular ischemia. Yep. Ventricular ischemia can cause PVCs to occur. This is why they say when somebody is having PVCs, we can administer or consider giving oxygen and fluids to these patients. There is no actual medication that you would be giving for PVCs. And for some folks, PVCs is completely normal. Okay. PVCs just are not normal when they're given or when they come out too frequently. We see too many PVCs, not normal. What are we looking at here? What's that photo?
Fuck is that?
What the fuck is that? We're looking at a pathologic Q wave.
Oh, it sure is. Shit. I see it now.
Pathologic Q wave. Now, basically, what a pathologic Q wave is it's wider and
Longer.
deeper, longer than normal, right? When we say something's typically pathological, it's greater than one little box in width. So it's usually greater than one little box in width for it to be considered pathological. And then the depth should be, it should be less, it's supposed to be less than a quarter of the height of our QRS complex. But if it's greater than a quarter, like this one looks like it's about half the height of our QRS complex, that's considered a pathologic Q wave. Now, if you don't remember what a pathologic Q wave is, all it's telling you is that this patient's either A, having an MI, or this
Or they had
patient
one.
has had an MI in the past. Good. Number 48, which of the following describes the ability of an organism to invade and create disease in a host? You got to know this term. It would be virulence. Virulence is a pathogen or organism, microorganism, that will cause damage to a host.
Oh,
Okay,
yeah, I remember
that is virulence. The other terms, host resistance is a rapid immune response to a pathogen. So if you create like a rapid immunity to this pathogen, that is known as host resistance. And pathogenesis is the development of a disease. When a disease develops, it's called pathogenesis. The other infectious neogenesis, I didn't know what the hell that was. Couldn't find it. Any good stuff on it. Number 49, on an EKG, which of the following represents the polarized state of cardiac action potential?
J point.
A.
It is A. Let's
Oh,
talk
is it?
about it. Yeah, it is. So let's talk about it. When we talk about depolarization, polarization, or repolarization, a lot of terminology getting thrown around. Whenever I say that something is depolarizing, I'm saying that action potential is occurring and it's creating a contraction, right? Whenever I say something is repolarizing, it's getting ready to contract or depolarize again. And whenever we say the term depolarization, typically we're talking about either A, the SA node causing a P wave, or B, a QRS complex. We all know repolarization occurs in the T wave, and that's just how we notify it. Now, talking about polarization, because we use the term depolarize and repolarize, but I didn't say anything about just straight up polarization.
Yeah.
Polarization just means it's waiting to be depolarized.
Okay.
And
The way I
where on an
remember that-
EKG is it going to be waiting? Isoelectric line. How'd you remember it?
The way I remember all those three is that for depolarization, it's like discharging the electricity across the tissue. Repolarization, it's recharging, and then polarized, it's ready to go.
Well, that's awesome.
Yeah, that's a good way to look at it.
That works for me.
Yep. When it's polarized, it's just saying that it's ready to go. It's on the isoelectric line, and then you're going to see a depolarization or a repolarization occur. So good question. 35-year-old presents with this device on their upper arm. What are we looking at?
Charlie.
Charlie, good.
I agree.
Okay, long-term vascular access. What kind of vascular access is that?
Pick line.
Midline.
That's a pick, yeah.
Oh,
Good. Okay. Good. Number 51. Uh-oh, we see something over here. This girl's got a zipper and she's got a pacer. Oh, I just gave it away. 70-year-old surgical. Yeah, artificial pacemaker. That's what we're looking at.
She's got a push start.
That's right. Hide your magnets. Okay, 52-year-old. I'm sorry, 52-year-old. Number 52. Which of the following describes types of hypersensitivity reactions? Select 2 answers that are correct.
I would say A and
A and E.
And D?
No.
I'll say D as in Delta.
D as in Delta is right, and A is right. Okay, so remember, whenever we say hypersensitivity, think like, hey man, this is like an allergic reaction. Yeah, exactly right. It's an allergic reaction. Your body's like, holy shit, what is going on? It doesn't like it, and it wants to fight it. Anaphylaxis, obviously, and then obviously a transfusion reaction. No, not good. Okay. Some of these other words over here, we got hemolytic crisis. With a hemolytic crisis, we're looking at a patient who has some sort of like clotting disorder, blood problem. And the other one, we got AIDS here, acquired immunodeficiency disorder, and myasthenia gravis. With myasthenia gravis, this person's kind of having a autoimmune disorder that's attacking their nervous system. Some of these patients have a difficult time thinking or communicating. I've actually seen a couple patients of mine with myasthenia gravis in my career. Number 53, when excess acid in the body combines with bicarb, it produces
Carbonic acid.
Carbonic acid. Awesome. Remember that carbonic acid now goes into the bloodstream, right? It buffers that pH level, and that carbonic acid gets transported to your lungs, and then you're able to breathe out carbon dioxide. Okay. And you're able to excrete or get rid of this high levels of acid. Which of the following characteristics associated with fetal alcohol syndrome?
Is that B and E?
Dwarfism actually isn't a part of fetal alcohol syndrome. It's A and B.
Oh, no shit.
Yeah, let me show you, man.
I thought I remember reading it.
This is an interesting one because fetal alcohol syndrome, the biggest thing that gets brought up like a lot is how it changes your face. Okay. When you look at fetal alcohol syndrome, we're looking at thinning of the lips, smaller eyes, right? Actually, the front of their head becomes smaller. So there's a lot of facial features that do change with fetal alcohol syndrome. So pretty interesting. A lot of people, they know about mental issues that people can have. But yeah, facial abnormalities is another one. Number 55, which of the following are abnormal conditions of red blood cells?
Red blood cells.
Anemia.
Okay, anemia has to do
Definitely
with
that
red
one.
blood cells. And there's one more that has to do with red blood cells.
Polycythemia.
Polycythemia.
Polycythemia, yes.
Too many.
Go ahead.
No, I just saying there's too many. That's what polycythemia means, right?
Yeah.
Yeah, exactly right. So either
Producing
too
too many
little
red blood
or
cells.
too much, right? Too little or too much. Anemia and polycythemia. Neutropenia means too little neutrophils. Neutrophils are a type of white blood cell. Leukocytosis is also dealing with white blood cells, right? And then hemophilia is a disease of clotting factors. Good. Number 56. Which of the
C.
following describes congenital heart defect?
C.
Yeah, tetralogy of Fallot. Tetralogy of Fallot, I want to say tetralogy of Fallot was in my national registry exam. Tetralogy of Fallot's a weird one because it is 4 different diseases of the heart that are congenital defects. So first off, pulmonary valve stenosis. So the pulmonary valve doesn't open and close like it should. A ventricular septal defect. There is a shifting of the main aorta that goes, it shifts in a different location. And then there's also thickening of the right ventricle known as ventricular hypertrophy. All 4 of these things are found within tetralogy of Fallot, which is a congenital heart defect. Number 57, 19-year-old complaining of difficulty breathing. You note wheezing in all lung fields, respiratory rate of 30 and labored. This is our capnography waveform. What do you guys note about this capnography waveform that's abnormal?
Shark waves.
All right, shark finning,
Asthma.
right? Asthma or bronchoconstriction. Good. Okay, Lucas says D, and D is right. Number 57 is D. Number 58. Which of the following characteristics are associated with Graves' disease?
C.
Oh, shit.
Definitely A.
Would it also be B?
A and B, yeah.
Okay.
And it's not F. Deficient steroid. No. A, B, and E, I think, but I'm not sure.
So now when we think of Graves, the one thing I want to tell you is, yes, we have some sort of typically a tumor that's on the thyroid gland, right? And it's overproducing. So typically when we have somebody who is overproducing on thyroxine, their heart rate's fast, they're dehydrated, this person can't sleep, their eyes get really big, their heart rate's fast, their blood pressure's up. They are like wired with Graves. So talking about that, a goiter on the anterior portion of the neck, right? Thyroid glands.
They're probably dehydrated
secrete more
too, though.
thyroid, and then also dehydration.
Yeah, makes sense now.
A, B, and C. Yep.
This is good stuff.
Number 59. Which of the following drugs are indicated for rapid sequence intubation? I didn't like this one too much.
Would it just be midazolam and ketamine?
Midazolam and ketamine are correct. Okay. Midazolam and ketamine are correct for this test question. I would
Can't you also
argue
do-
that E is also
Yeah, you
in
should be in there
many
too.
RSI kits. A lot of
Yeah.
people use fentanyl as a syncing. It syncs with a lot of sedatives. So if you give a sedative, for example, midazolam, and then you also give fentanyl, these people become sedated very well. And this is why a lot of people like to use fentanyl in their RSI kits.
What's that
But-
called when the medications piggyback off each other and they work well together? I can't remember
Synchrony.
the word right now.
Yeah,
Oh,
it's
okay.
called synchrony.
Okay.
Number 60. Which of the following describes vapor density? Such a strange question. I'm like, is this a fire exam or is this a medic exam?
Is that A?
Vapor density.
Would it be B?
It is B. So
Oh,
think
yeah,
of
yeah.
B. When you think of B, it says the weight of gas compared to equal volume of dry air. Now we're talking about how much density is air. It's 1, right? For anyone that went to fire school, they know that vapor density of 1 is air. Anything that is greater than 1 will sink. Anything that is
sinks.
greater or less than 1
High.
rises.
Yeah.
That's vapor density. Number 61, which of the following would likely cause the heart rate of an adult to fall 20 beats per minute during an intubation attempt?
B.
Lucas is saying B.
Vagal
Vagal
Yes,
stimulation.
it is
Vagal
vagal
and all out.
stimulation. Exactly right. So if I go ahead and stick my laryngoscope blade in somebody's mouth, I stimulate a gag reflex. This is going to cause a vagal response. and then we can have a drop in the heart rate.
Lucas,
All
get in here,
right.
man. I miss your jokes.
I don't. They're always towards me. I miss it. I miss it. It's good times. I got a good class right now. I got 25 in my newest class. They're good.
My
It's
instructors suck. Mike's awesome.
All right, Mike. This
Y'all are
one is going to be
privileged.
rough. We got another math question here, man. And this one is a little rougher. We're talking about the Parkland formula. We got a 154-pound patient suffered thermal burns to 30% of BSA, right? Using Parkland formula, how much IV fluid should be administered over the first 8 hours? Now, before we get into Parkland formula, the first thing I want to tell you guys is we are not even going to consider the Parkland formula unless their BSA is greater than 20%.
Yep.
Okay. So if I
Okay.
have body surface area of, let's say, a circumferential arm, which would be freaking terrible. Remember, that's 9, right? 9%. But if I start calculating and I have greater than 20, now I need to consider a Parkland formula. Now, the first thing I want to say about Parkland formula is there's a lot of fighting going around right now in the community about trauma and should we be giving fluids to patients that are burned? Yes, I think we should, but are we doing too much? And is it a problem overloading fluids on these patients? And yes, it can be a serious problem, right? We can actually cause a lot of harm if we give too much fluids too quickly to patients that are burned. So is the Parkland formula right now still going on? It is, but is it going to be going on forever? I don't know, right? There's a lot of
Maybe
discussion
some
to get rid of
changes.
it. So jumping into the Parkland formula, let's do it. So the first thing we got to do is, I know you want to answer it, but let me do it real quick. 4 times, oh, I'm sorry, I got to freaking get the weight. 154. Okay, it's 70.
Yeah.
70 times 4
Yep. Times 30.
times the body. Yep, 30 percentage. Okay, so this is the amount of fluids for what?
First 8 hours.
No,
That's the
easy.
total.
Oh wait,
That's
it's
my
total. My bad.
total.
I'm sorry. Yeah.
Yep, easy. So that's my total. That's over 24 hours.
Yeah.
Now I need to divide that number by 2
A.
to get my first 8 hours. The
Yeah.
answer is A, alpha.
Oh shit.
Good.
I forgot.
That looks
Good.
funky. Not good. All right. 55-year-old presents with a mass in their abdomen. You suspect it's an inguinal hernia. All right. Based on the patient's presentation, which of the following most likely is the organ seen protruding in the paragraph?
B.
What do you guys think it is?
Would it be his intestines?
It is. So if you knew what an
Wait,
inguinal
right,
hernia
yeah.
is,
Yeah.
an inguinal hernia occurs when tissue of the intestine. So tissue of the intestine is protruding through a weak spot of the abdominal muscle. So abdominal muscle becomes weak, that intestine starts to protrude through the muscle. And now we can see it whenever the patient is bending over or picking up or straining their abdominal muscles. They look like a freaking alien. We got one guy in my zone who freaked me out the first time I ever saw him take his shirt off. I was like, oh, it looked like aliens. That thing was coming out of his freaking stomach. Freaking terrible. Look at this chick. Holy.
That's
Which
a
of the
goiter.
following describes a mass? Yes, of the anterior neck. This is known as a goiter. Good. Goiters can be freaking scary, man, for airway management, depending on their location.
Go on
Here
a
we
date,
go.
you see that.
Looks like we got another math question. 44-year-old in cardiac arrest. Which of the following is the dose of our epi? So first thing we need to do is figure out our weight. 44 divided by 2.2 gives us 20. 20 times 0.01. 0.2. Answer C, Charlie. Which of the following is a characteristic of peripheral inserted central catheter? What is that? A PICC line.
Yeah.
Okay. What do we use PICC lines for? Drug administration.
Yep.
That's what they're used for. Typically, when you have a PICC line, I know right here it says remains in place for up to 12 months. Typically, when somebody has a PICC line, it goes up to, I think it could go further than 6 weeks. I know that a lot of people, when they get put on PICC lines, it's for long-term antibiotic use, which is usually around 6 weeks. I had one. It sucked. Number 67. I would not know this answer. I'm sorry.
I think
Which
it's
of the
IgG.
following? It is IgG. It is A. Which of the following antibodies crosses the placenta barrier to produce fetal immunity? And if you don't know which one gives immunity, it is immunoglobulin G.
I would have never
I
touched
would
it.
have, Ali, I'm right there with you. I would have never guessed that shit. I would have been like this, a shot in the dark. Please, Lord, give me the answer.
It guards. There. That's how we remember it. It guards immunity.
If I get that
Okay.
right,
Oh, that's a good way.
and I'm gonna thank you forever.
IgE is usually like anaphylaxis, right?
You said IgE?
That's usually like anaphylaxis, right?
Let's take a look. I don't know any of these immunoglobulins. I probably should.
Guys, we know,
think
we know now
IgE
something like that.
is anaphylaxis. IgE is anaphylaxis, I think.
That's what I thought. Yeah.
Immunoglobulin test IgE antibodies. Yep. So that would be
Yeah.
immuno. Yep. For sure. Good.
That's how
All
I
right, we
remember
got-
those two.
Yeah, that's good, man. I would have been freaking screwed. All right, looks, we got a 100-kilogram patient suffered thermal burns to 40% of their BSA. All right, let's do it.
We do it again.
So 4 times 100 times 40, right? So that's total over 24 hours. Now we
Divide that
divide
by
that by
2.
2, 8,000.
8,000. Yeah.
Answer is
I
A.
literally just watched your video on this last week, so I feel like I cheated.
So you were ready. You were ready for that shit. Let's look at 69. From which of the following directions is it most dangerous to approach a helicopter? This is an ops
That.
question.
The rear.
You got to know that from the rear. When a helicopter's rotors are spinning, the rear is so fast that you might not even see it.
Yeah.
And that shit will decapitate you. So just be mindful.
Lucas, you're gonna lose your head.
Yeah, don't do that. Which of the following conditions are associated with malnutrition? Select 3 answer options that are correct. Malnutrition.
Would it be the first 3?
A, B.
Hmm.
Also hypoglycemia? Everything.
So believe it or not, rhabdo.
A, B, and F. I
It's A,
think.
B, and D.
A, B, and D.
Malnutrition. Yes. So now, kind of like an odd one. I could say for sure hypoglycemia. Yeah, we got somebody who is like not eating. We always want to check their sugar because they
yeah.
might not be, eating. They're malnutritious. So we always need to check sugars. Dehydration, absolutely. If somebody's not drinking any fluids, vitamin deficiency is
Definitely.
obviously a form of malnutrition. Rhabdomyolysis is a breakdown of myoglobin in muscles. And it could be a breakdown because of lack of oxygen, right? We can't really say it's malnutritious. So it's not from like vitamins and nutrients. It's like, hey, dude, we're not getting oxygen to this tissue. It's causing rhabdo. No bueno. And polycythemia, remember, too much red blood cells, jaundice,
Yeah.
typically seen with liver
Liver.
failure. Yep, good. Number 71, which of the following treatments for crush syndrome? This kind of got brought up earlier today.
Sodium.
Beanie.
Yeah.
Be
No,
what?
you wouldn't do massage.
Uh-uh.
Let's
Oh,
see,
knee.
sodium. It's
B and E.
and- Yeah, B and E definitely.
Do not
we'll bring
massage
it in
the
there.
limb on a crush syndrome. That is no bueno, right? We do not want to move. some
And
of
they
that
wrote
stuff.
message instead of massage. Limb message.
Limb message. That's awesome. But yes, IV fluid bolus. Remember, that's the first thing that we're going to be doing. We're going to start with it's not necessary. I can't say that. I was right about to say hemodynamic stability. We're not worried about hemodynamic stability with crush syndrome, but we do want to give fluids, right, to combat rhabdo. So we'll start with our fluids. We'll give oxygen. Then we need to consider sodium bicarb, albuterol. If we start to see peak T waves or any sine waves, those wide and QRS complexes, that's when we're going to consider calcium to, remember, help out that heart tissue. Number 72, which of the following describes the ability of a drug to bind with a particular receptor site? This is straight up
that B?
words. You know, if you don't know the definitions of these words, it can be challenging.
Affinity. Delta.
It is actually, yes, D as in Delta.
Oh, affinity.
Now, so when we talk about affinity, I'll say all of them, right? So affinity, defined as the extent or fraction to which a drug binds to a receptor site at any given drug concentration. Okay, so a drug that is binding to a receptor site. Now look at the other one. Potentiation, crazy ass word. When one drug does not elicit a response on its own, but will enhance the effects of a different drug.
Yeah.
I'm going to repeat that. Potentiation, when a drug does not elicit a response on its own, but enhances the response of another drug. Efficacy, the maximum response that can be achieved from a drug. The best that that drug can do is its efficacy, right? It might be a time that it's given. You get the best efficacy by giving this drug over 2 minutes. You know what I'm saying? So they'll use that kind of terminology. Potency refers to the amount of drug needed to produce the effect. The amount of the drug. You have to give 6 milligrams of adenosine to get an effect, right? That is the potency of that drug. All right, jumping into the next one. Which of the following statements is correct concerning this rhythm? Drives me nuts. They're showing us another inferior wall STEMI, right? We're looking at another STEMI. Number 74, which of the following drugs produce a chronotropic effect of the myocardium? Chronotropic.
So wait, I'm sorry, for 73, it would just be C? That's all they're asking for, is just identify the STEMI?
Yes.
Okay.
Yep. Number 74, which of the following drugs produce a chronotropic effect on the myocardium?
B.
Is it A and B?
A and B?
This is an interesting one. First off, what the hell is
there's two.
verapamil?
The
Since
Verapamil.
you guys want to pick verapamil, he
Oh,
said
shit.
verapamil. No, that's what people call it.
Yep.
Right. Okay, so verapamil and diltiazem are the same, right? So they're not actually both
Is it
diltiazem,
B
but
and
they are
C?
both calcium channel blockers. Okay. B, we know, is a sympathomimetic that will increase rate. And C, albuterol, is also a sympathomimetic that will increase heart rate. We know albuterol as the bronchodilator. Yes, it does bronchodilate, but it does also have a sympathetic reaction when used. Whenever you give albuterol, pay attention to the patient's heart rate. It will go up.
So that answers B and C.
B and C.
Okay.
I'm slowly getting better at pharmacology. It's about time.
Quadriplegic adults presents with AMS and difficulty breathing. You note urine and the patient's drainage bag is dark and yellow. All right, they're already painting a picture for us. I can smell it now. BP 86/60, pulse rate of 130, 24, respiratory rate, labored. Skin is hot and moist. Shocking, right?
Septic
Temperature
shock.
is 102.8.
Yep.
My God, can they give you any more information about this patient's septic shock?
AB
My man's
septic.
septic.
AB
Yes.
stinky and hot.
Yeah, they're giving you every freaking definition in the book to point at sepsis. Thank you, Tess.
Fluids and antibiotics.
That's it. Number 76, which of the following conditions activates the renin-angiotensin-aldosterone system? Holy, that is a big system. To increase blood pressure and maintain cardiac output.
Your renal failure.
76.
Hypoperfusion.
Is that D?
100% hypoperfusion. So let's talk a little bit about this system first off, because we can say that, hey man, like it does deal with the renal system, right? So that could possibly throw you off. But whenever we talk about the renin-angiotensin-aldosterone system, this system kicks on when you're hypotensive and your body says, holy shit, we need to bring up pressure. Okay. It's associated with blood pressure regulation. It modulates or fixes blood volume, sodium reabsorption, potassium secretion, and water reabsorption. All right. So it starts moving around fluids throughout your body to try to fix your blood pressure problems. So this does occur with hypoperfusion. Good question. Number 77. Holy, have I never seen this question before? Which of the following characteristics are associated with diabetes? What are the 3 Ps?
Polyuria, polyphagia,
Polyphagia, polydipsia.
and
Polydipsia. Good. My gosh, I have seen that in every paramedic test ever created. Okay. Number 78. This is one I did not know. Okay. So 25-year-old complaining of difficulty breathing with a productive cough, employed to clean homes, barns, and sheds that are infested with rodents. He reports that now he is sick. Based on this patient's presentation, what's your differential diagnosis?
Is that C. diff?
It's not C. diff.
Antivirus.
Okay. It's a hantavirus. So
Never
first
heard of
off,
that.
I'd never heard of it either, but C. diff is a GI issue. Okay.
Oh,
So
that's
people
right.
with C. diff, they shit like crazy.
Yeah.
And typically you'll see C. diff patients. Those are like people that are coming off cruise ships, and there's a ton of people that are sick on the ship.
Mhm.
C. diff is extremely contagious. Hantavirus, believe it or not, comes from rodents,
Oh,
and it affects your lungs.
makes sense.
Okay. So
Lyme
interesting. I
disease
didn't
from
know.
ticks.
Yep.
What was
Stats in
70
hospitals usually.
Yep.
What
Good.
was 76?
Oh, I'm sorry. What was that, Jacob?
76.
76 was D, hypoperfusion.
Thank you.
Yep. We're getting through this. I know we're already almost at 8 o'clock. If you guys got a bug out, don't worry. You can. I'm going to continue. I'm going to finish this, and I will even send you the link. But yeah, I respect your time. But I'm going to finish this off for those of you who want to stay with me. 79, obese 58-year-old complaining of difficulty breathing. History includes a 40-year history of heavy cigarette smoking and a productive cough. Holy crap, right? We got high blood pressure, high heart rate, respiratory rate of 28. Skin is blue of complexion. We got a partial oxygen saturation arterial. I don't even think this should be a percentage. I'm pretty sure PaO2s are measured in millimeters of mercury, but I think they're meaning SpO2 of 88%. End title's 58, so they're retaining. Not good. Based on patient's presentation, what's your differential diagnosis? What would you guys say? We got a lot of
C?
information.
I would
I say A.
I say A2. Okay, chronic bronchitis. They're pointing every direction that this patient has COPD. 40-year
cigarette
history of
smoking.
cigarette smoking, low capnography. I'm sorry, high capnography, low O2 sats. I wish
They
they would
didn't
give
say.
more.
Usually
Go ahead.
they're overweight. They didn't put that in there.
They
That's
did.
usually in that quick. Oh, I guess I didn't see that. Son of a bitch.
Yep, they did.
I was
Um,
gonna ask, when you're looking at questions, like for example, when it says productive cough, is that a sign of chronic bronchitis? Like, would that
It
be?
is.
Okay.
Yeah, chronic. Yeah, whenever we say chronic bronchitis, that means productive cough. I believe by definition, chronic bronchitis is like you have a productive cough over 2 months, or is it over 3 months? Now
3
I
months,
need
I
to
think.
let's take
Look
a
that
look.
up. I
'Cause
think it's 3 months.
that definition always made me laugh because it's so all over the place. Chronic bronchitis, a productive cough that lasts at least 3 months within reoccurring bouts for at least 2 years.
Oh, that's
So
right.
2 years, you have at least 3 months of straight coughing that is productive. So that's by definition. And they kind of painted that picture exactly for chronic bronchitis. 80, 19-year-old complaining of sharp chest pain, difficulty breathing, moving heavy boxes when the symptoms suddenly occurred. You note diminished lung sounds on the left-hand side. We have a great blood pressure, little tacky, but SpO2 appears normal. Based on patient's presentation, what's your differential diagnosis?
D.
D. Good. Now question, Mike. Why didn't you say it's A? I'm just curious.
Mm,
Just
No
because
trauma.
I'm telling-
just because no
Okay.
trauma.
So I'm going to tell you how to answer that one easy, bro. For
Okay.
whenever you take this test, the National Registry, if you're trying to differentiate between pneumo and tension pneumo, always think, is my patient in shock or not?
Oh, okay.
Is my patient in shock? If your answer is yes, your
Yeah.
patient's in tension.
Oh,
Okay. That'll make your life a whole lot easier.
okay.
Even
Number
if they
81.
don't throw the, even if they don't throw the late sign of like the
Yeah, the tracheal
deviation.
deviation, JVD.
Yeah.
Absolutely. I know I had two questions on my National Registry talking
Mhm.
about, is this a pneumothorax or is it tension? And it's all you're looking at is the vital signs. If I don't see shock, it's
Okay.
a pneumo.
Okay.
Number 81, which of the following characteristics are associated with left ventricular failure? Select 3 answers. Left ventricular failure.
Let's see.
C.
Yeah.
Okay.
B.
Yeah, B, C, and D, I think. No.
Mhm. It is. B, C, and D. Okay. Left ventricular failure. Left ventricular failure can cause dysrhythmias. Okay. Tachycardias. Pulmonary edema. Everyone knew that, right? We got left-sided heart failure. That blood is starting to back up. It's causing my patient to have crackles or rails. And then PND, right? Proximal nocturnal dyspnea. That's orthopnea. My patient, whenever they lay down in bed, they get short of breath because of their positioning. Okay. These people, they wake up, night sweats. They have to sit up in a recliner, and that's how they'll typically sleep because of PND. This is 100% left ventricular failure.
Like I was
Good
gonna
question,
ask about 80. If they put like, well, how would you differentiate? Like, let's say what if spontaneous pneumo was one of the options? Could that be a correct answer? Or
Absolutely. Whenever they say spontaneous pneumo, it's the same thing as a pneumo,
okay,
right? Absolutely. A good question.
Usually
couple
they'll say
things.
tall,
Go ahead.
skinny people for that one, usually.
Yeah, true. Yep. Tall, skinny people, if they do start like giving you a more of a description of the patient, they might be pointing at that.
Like Abe Lincoln.
Like Abe Lincoln. Herring-Brewer reflex. Anyone want to take a stab at what that is? Because that is in your textbook.
I forget.
Yeah,
So Herring-Brewer reflex is a reflex that's inside your lungs.
overexpansion.
Oh yeah, stop you from breathing in.
Yep. So if I take a deep breath, I know that that's a maximum that I can breathe because of this reflex. Good. EKG shows this rhythm. What do we see in this EKG?
PAC.
See a PAC, right? So everyone sees that right here is where this PAC is occurring. We see that we know it's a PAC because not only does it have a P wave, but it's also narrow and complex. What can cause PACs? Stress. Listen to this, man. Most people will experience PACs at some point in their lives. They are often a result of stress, caffeine, or even alcohol. And they typically occur when the patient's at rest. It's every day for you. Rosa's on all 3 of those right now.
I'll take the wombo combo, please.
Throwing several PACs during this lecture. So adult who presents with dehydration and hyperosmolar hyperglycemic syndrome would likely benefit from an administration of what?
Let's see.
Come on. You got a patient with hyperglycemia. What are you going to give them?
B. Dextrose.
You're definitely not going to give dextrose to somebody with high blood glucose.
Oh, shit. What am I thinking? Shit.
You're going to give C, normal saline.
Oh, okay.
Right? We give normal saline to patients not only that are dehydrated, but also have high blood glucose levels.
Yeah, because you
So-
want to, what's the word?
Dilute.
Dilute them.
Yeah, you want to dilute some of that blood. Think of that blood like syrup.
Yeah.
It's high in sugar. We want to try to dilute it, thin it out a little bit.
Yeah, that was stupid.
No, you're good, man. Which of the following findings is most concerning for an elderly adult presenting with exacerbation of emphysema?
Altered mental status.
Oh, yeah. Because how many of you, your eyes directly go to barrel chest, right? You're like, oh crap, barrel chest, that's bad. It is bad, right? That means that this patient has late signs of COPD. But
That's a normal
understand
finding.
AMS is freaking way worse. Any patients
But
got
the-
shortness of breath and AMS, this is now a problem. This patient is unstable.
But the barrel chest is a normal finding with that. Even if, I mean, it's late stage, but doesn't that
It's
change him?
late.
That's not
late
most
stage.
concerning though.
Yeah.
No, I know
late
it's not the
stage.
right answer. That's why I'm saying barrel chest is
Yeah.
a normal finding. Therefore, it's not a red flag.
Yeah. Usually when I see barrel chest, like I'm like, oh crap, like this person's in like, they're in bad shape. These are
Yeah.
old people that have had COPD for so long. When I see somebody with a barrel chest, I'm like, dude, this person's probably satting at like 86 and they're completely normal like that.
Paper bag
Um,
lungs.
Yep. And yeah, they have overinflation in their lungs. Now, an interesting conversation to have with these COPDers, especially in that kind of condition, is polycythemia. Now, we talked about polycythemia earlier, saying that it's an increase in red blood cells. Why would a patient with COPD with a barrel chest have polycythemia? Because what do red blood cells carry?
Oxygen.
Oxygen. So if this patient is hypoxic all their damn life, or for
Yeah.
so many years, their body says, dude, for me to live, I need
Yeah.
to make more red blood cells. So this patient's blood becomes thicker.
Yeah.
The viscosity of their blood becomes so thick. Now, what is that going to do to their cardiovascular system? Their
It'll make it work
cardiovascular
harder.
system, it makes it harder.
Yeah.
All right. So do not think that these patients with end-stage COPD also don't have heart failure, because guess what? They probably do. And it's because of this thick red blood that is circulating through their blood. And now their heart has to work harder to basically push that shit along. So do not be surprised when you see swollen ankles, right? You might have a lower blood pressure. You start seeing other signs of maybe right-sided heart failure. This is why. It's called cor pulmonale. All right. 85. You respond to a community alcohol detoxification center where a restless 45-year-old's complaining of nausea and vomiting. Staff member also reports the
sorry, what was
patient's been
85?
hallucinating. What did you say, Rubio?
I'm sorry, what was 85?
No, we're doing 85 right now.
Oh, my bad. I heard 86. My bad.
No, yeah, this is 85. So this
All right.
patient's 45, complaining of nausea and vomiting. Staff member also reports patient's been hallucinating. The patient has been in the center for 48 hours with worsening symptoms. Blood pressure 90/50. The patient has a high heart rate. Based on the patient's presentation, what's your differential diagnosis?
Hey,
Hey.
Good job. Hey, DTs, man. DTs. So
Needs to
talking
drink.
about delirium tremens, a lot of times people think of this, right? They think with DTs, the patient's shaky. If you ever see a homeless guy on the side of the road and they're like all jittered up, those are DTs. This person has alcoholism for years and years and years, and now all of a sudden they cut cold turkey. Okay. Confusion, shaking, hallucinations, these are all normal signs of DTs.
watch The Last Samurai. Depicts it great.
Sounds like Chris.
Sounds like fact. Okay. Another ops question. This shit makes me laugh. You see questions like this, it's like, dude, this isn't fire school. They're talking about, oh no, I'm sorry, I was looking at this freaking photo. Which of the following describes a crime committed against a person solely because of the victim's perceived race, color, or sexual orientation?
See,
That's a hate crime, y'all. That's a hate crime. Now, here we go as a fire question. What the hell? Looking at this photo, we're looking at a corrosive tanker. I don't have my damn ERG with me, but which following statements is correct concerning this type of tanker that transports hazardous products? By looking at this photo, do you see anything that looks different? Yes. It has reinforced rings around it. Okay. It's carrying corrosive material, so it has to be in a special type of tanker so it does not leak through the tanker itself. Number 88, 17-year-old who is 12 weeks pregnant. Geez, 17. 12 weeks pregnant, complaining of abdominal discomfort and vaginal bleeding. We got a decent blood pressure. I'm fine with a heart rate and respiratory rate. Based on the patient's presentation, what's your differential diagnosis?
Skeletal.
What are you guys thinking? And there's one thing that's giving it away. It's this.
I was thinking threatened abortion
Mm-hmm.
Yeah, she's too early on.
because she's
Too
Oh,
early, man. It's too early to be anything else. Okay. When we're looking at abrupto placenta and placenta previa, those are third trimester.
Yeah.
Mhm.
Okay. So that's third trimester. Now talking about toxic shock syndrome. What the hell? Like there's nothing in here
Vitals
that's
are
talking about
vitals are fine.
sepsis. Yeah, that's like way out of left field. Nothing in
Yeah.
here is talking about sepsis. So threatened abortions. Understand that abortion is at a higher chance during early pregnancies. Okay, first trimester. So number 89, which of the following is considered a weapon of mass destruction?
Sarin.
Sarin, good. Sarin was created in Germany in 38. It's a pesticide. Okay. So this is organophosphate poisoning. It's a nerve
Trench
agent.
warfare.
Yep. Chemical warfare, nerve agent that's most toxic and rapidly acting, known of chemical warfare. Similar to certain kinds of insecticides or insect killers, these organophosphates work on harmful effects just like an insect killing treatment. And it was used in warfare. That is sarin. Number 90, which of the following conditions defines the patient's transitional stage from having HIV to AIDS? Kind of
Is
a
that
tough
B?
one.
Kaposi sarcoma.
It
Yeah.
is Kaposi sarcoma, man. I did not know. I was like, oh, I was trying to think about it. I had to look up Kaposi sarcoma, and it's like these purple lesions.
Isn't it like a cancer?
It is. It is a cancer. Here, I have some stuff written down for it. Kaposi sarcoma is one of the main types of cancer that affects people with HIV. It progresses very quickly if not treated. Kaposi sarcoma is a type of cancer that forms in the lining of blood and lymph vessels. Okay, it typically appears as painless purple spots on the legs, feet, and face. Lesions can also appear in genital areas, mouth, and lymph nodes. Typically, when seen in a patient that has HIV, this is a tall tale sign that this person has now developed AIDS. So good. I did not know that. Number 91. Which of the following is a characteristic of bariatric patients? Select two options that are correct. Characteristics of bariatric patients. This is such an odd question.
Would it be that obtaining the vascular access is difficult? I had a hard
It
time.
is.
I'd say that.
It's B and C.
That is
isn't it?
one of them. B and what?
I'd say A and
C.
B.
No, it's because you can't say weight estimates may be
Oh, yeah, yeah.
inaccurate.
and
It's
C.
like, no, you're not bariatric.
Heavy is
Um,
heavy.
Yeah,
B and C
right?
should be. Yeah.
B and C are the right answers. Number 92. Which of the following equipment is required to perform tracheal bronchial suctioning? I did this recently on a patient.
Oh, that's B.
Yeah.
It is B, soft
Yep.
tip catheter. Remember, my
Whistle
advice
tip.
for whistle tip. My advice for suctioning. If you can't see where the tip is going, use a soft tip. Right? If I could open up a patient's mouth and I could see the fluid that I want to suction out, I will use a
Okay.
rigid tip. If I can't see where it's headed, aka going into the nose, going through a tube, going through a stoma, I'm always going to be using a whistle tip.
I don't know. I think a blub syringe sounds pretty fun.
Yeah, blood syringe does sound like a good time. Number 93, adult motorcycle rider was involved in a crash and presents with signs and symptoms of attention pneumo. Where should you perform needle decompression?
Charlie.
C.
All right, good.
Yep,
We
yep.
know that it's never going to be inferior, right? Because we don't go below ribs. If I
Yeah.
go below ribs, I'm going to hit vascularity, and
blood
I'm also going to hit
supply.
nerve
Yeah.
endings. Good. So it's always going to be superior above the rib. And then we just got to make sure you know where it's going. It's not going to go the second mid-axillary because you know that's fourth and fifth. Good. Number 94, 24-year-old bull rider is in cardiac arrest. I didn't like this question. During the event, he lands on the ground and the bull steps directly in the center of his chest. Arena personnel immediately find this patient apneic and pulseless. Based on the patient's condition, what's your diagnosis?
B.
Although it is nightmare fuel, I agree with B.
It is B, commodio cordis. Now, could this patient have an aortic dissection? Of course they
Yeah.
could, man.
Yep.
Could this patient have a tamponade? Of course they can.
feel
And
like
could
all
they have
those
a
answers are
myocardial
right.
Yeah,
contusion?
you could have all that.
Yes. Yeah, I didn't like this question because of that. But saying like, hey, which one of these things or which one of these answers will cause immediate death?
I like the
Commodio
baseball one better, where he gets hit in the chest with the baseball. after he
Yeah.
gets hit.
Yep. Yep. So bad, right? Commodio cordis, we're having an R wave on a T, right? Not good.
My favorite.
I hope not.
Look, it's another inferior STEMI.
How fucking terrible is this, huh? Dude, whoever wrote this test, damn you. Again, we see some. At first, when I glance at this, I'm like, hey man, it looks odd to me, right? I feel like this EKG needs to be like stretched out a little bit
Yeah.
because this convex is like so jammed in there. Kind of even looks like peak T waves in a way. They kind of smashed it. But yeah, it's just another STEMI. Terrible. What do we see with this lady?
Decorticate.
Something not good.
Not good, right? We know it's
Corticate.
decorticate because it's going towards the
Arms
what?
towards the core.
Oh,
Yep, towards the core. Which one's worse, the cerebrate or decorticate?
Cerebrate.
Just cerebrate. Good. And how you remember that, or how? Remember with GCS, one thing I always recommend students to do is before you sit for that exam, write down your GCS next to you on that sheet of paper that they're going to provide. Remember, if the patient has no movement, it's going to be a 1. If the patient has decerebrate, it's a 2, and decorticate is a 3. So that's how I would probably try to memorize that. Decerebrate's always worse. Decerebrate, I always remember as a 2 on my GCS. 97, we're almost here at the end. Which of the following are locations where congenital heart malformations most likely occur? This is challenging, man. And I'll tell you why. What do you guys think?
is it both valves and the pathways?
So if I told you malformations always, or I can't say always, but they mainly deal with septums and valves. Okay.
Yeah, right.
Septums and valves. Because when we think about malformation of, let's say, tetralogy of Fallot, remember I said there was a problem with the septum, ventricular septal malformation. Very common. Well, the septum have an issue where there's a hole in it and blood will leak from one side of the heart to the other. Okay.
So is it B,
So
E, F?
knowing this, we can kind of cross some stuff off. Aortic arch, no. Internodal pathway, no. So that leaves us with 4 answers: ventricular septal wall, atrial septal wall, and then we got 2 valves.
Okay.
So being at like
PCEF.
full of, yeah, you'd be guessing. I'm telling you now, I would as well. It actually is BCE.
Oh,
Okay,
all right.
E, pulmonary valve is more likely to have a malformation than the mitral valve. I didn't know that.
I said 3 in my bed.
Yeah, so it asked for
Definitely
3
don't feel as
answers.
bad now.
Trust me, I wouldn't. Yeah, I would not know that answer. 98. Which of the following statements is correct concerning organ transplants?
Problem.
Is that B?
It is B.
Rejection within 3 months. I remember reading it.
Yep. So type of organ rejection you experience depends on the timing after the transplant. So there's something called acute rejection and chronic rejection. Acute rejection occurs the first few months. This is most likely when a organ transplant is going to occur, right? Or there could be a chronic rejection, what can happen after years after the transplant, which is pretty wild to think. Right. But yes, most common organ rejections occur within 3 months. All right, we got a car accident here. Which of the following conditions presents the greatest risk in this photo?
C.
Traffic.
Traffic.
I think it's C.
Yeah, traffic. Yeah.
Traffic is actually the most important or the worst part about this accident right here, because just looking at that roadway, that shit is massive, right? So we're gonna have to block some lanes. There's a lot going on in this car accident. Saying, dude, I'm like, as a first responder, I'm looking at the car door. I got intrusion. Anybody who is in that passenger seat is going to a
Having a
trauma
bad
center,
day.
right? I got fluids on the ground. I got a lot of debris. There's sharp edges. There's all this stuff, but I also see traffic that's going by. Understand, people do not give two shits about you as a responder. Make sure that you're blocking traffic. Incidents. Number and the last question. EKG shows this rhythm. In this rhythm, P waves that occur without subsequent QRS complexes are suggesting what?
B.
B. The electrical impulse was not conducted to the ventricles. That's all it's saying. Would any of you guys call this a third degree block?
Everything marches out. I wouldn't call it no.
No,
maybe
right?
maybe like a second
Second
type
degree
two.
type 2.
Two, yeah.
right?
Yeah, not a winky box.
Yeah, definitely not a winky box. Now, if I take a look at this and I say, hey, man, look at the distance between this P wave and this QRS complex. And I say, hey, is it any different than this one here? Or
No,
is it
they're the
any
same.
different from this one next to it? Right?
Nope.
If I'm able to say that they are all the same, then it is 100% not going to be for one, a second degree type 1 or a third degree block. But we can all agree that there is something wrong with conducting the ventricles. Right? There are missed QRS complexes, which all that means is it's a conduction of the ventricles and we're missing them. So good. That is bravo as well. Lucas, no, I do not have a Socrata for this. That concludes this, man. This is, I hope this
Awesome
helps.
stuff. Hell yeah.
That was good. That was good.
Yeah,
I
I
love
think
that.
this is a good way to
Thank
like
you.
practice, because not only you get to take the exam, but then you also get to like go over it. We can have a discussion on it.